As a key player in the healthcare industry, you've always been at the forefront of change. Yet no period in our industry's history has ever promised the scale of change that technology and governmental reform are bringing to the field of healthcare today. That's why it is more important than ever for your organization to find a dependable, accountable care organization partner that can strengthen your commitment to long-term care and help reduce costs. For more than 30 years, the Ambassador Healthcare System has provided high-quality healthcare to Nebraskans in need of our specialized services. The Ambassador's professional faculty and state-of-the-art facilities enable your patients to continue to receive skilled rehabilitation therapy, ventilator and pulmonary care, and pediatric rehabilitation and extended care, all at the hospital level and all focused on something we call Homeward Healing.
I'm Tim Schultz, President and CEO of the Ambassador Health System. We've been a part of the Nebraska landscape, I would say, for probably the last 30 some odd years. Looking at the history of what the involvement of long-term care has been is one of really trying to get people well and go home. So the history of the Ambassador is just full of success stories, and one that we're really proud of.
We at the Ambassador educate our staff to follow the same procedures and care that's been provided for patients in the hospital so that disease processes will be managed and maintained so that the patient can achieve their ultimate goal of returning home.
So why is the Ambassador a great partner to assist your organization with its long-term care needs?
The Ambassador, we provide incredibly high acuity care. We provide ventilator services for patients who require vent dependence. We provide tracheostomy care. We provide oxygen, any type of tubes, chest tubes, dialysis. We provide those services.
What's being done for them in the hospital, we can duplicate it here. We have wonderful technology. We have support from the administration, quality diagnostic equipment, ventilators, and support staff.
A child who is in the hospital, who's no longer has the acute care needs, but still is not well enough to go home, they can come to the Ambassador, and we can provide that transitional place for that parent and that family. We continue to work with the goals of the physicians and the family in getting that child home. We can teach the family all of their cares. We do discharge planning so that the families get to know the home nurses that are going to be coming into their home, and that we can train those nurses so that they are skilled on all of that patient's care as well. Therefore, we're ensuring a very safe and consistent transition home. These transitions also help cut down on the rehospitalizations for this child after they do go home.
By providing seamless transitional care from your facility to ours, patients admitted to the Ambassador are able to effectively transition back into the community at a high rate. This homeward healing approach is something that is a focus for all the healthcare professionals that make up the Ambassador team, and has been a fundamental part of our success with patients that require even the most skilled methods of care.
I think the team approach is very important and unique here, that we all work so closely together. The Ambassador accepts patients that are more difficult patients, more comorbidities, acute illnesses, and so we really have to work as a team to ensure the patient's total success and return home or return to their prior level of function.
We know our residents, we work very closely with our residents' individual needs. We are able to work with the families of residents to provide foods that we know they care about, so that we can make an environment that is conducive for intake so that they can regain their health as quickly as possible.
Working closely with patients and their families has earned high marks from our patients, providing you with the peace of mind of knowing that the high level of care and commitment to excellence started by your organization will be maintained throughout your patient's entire rehabilitation process.
Our staff try to prevent rehospitalizations by utilizing our medical director and our nurse practitioner that come to our facility. Our medical director comes twice a week, and our nurse practitioner comes at least 4 times a week and is available by cell phone. We are able to get a hold of any provider that we need to almost immediately in order to get what we need. We utilize them so that they can give us insight on any conditions or problems, that we can get some of those labs or x-rays to take care of the patient and try to get it handled instead of sending them to the hospital.
So, not only is the ambassador able to efficiently transition patients by closely coordinating with your staff, but we're able to do so effectively with readmission rates that are 28% lower than the national average. In short, our focus on homeward healing works.
We're not shying away from highly skilled patients that might come our way. We're on the leading edge of education and thought process and systems, and we have just a huge level of support. So I think we've really established in the community that we are a leading provider.
Hospitals would want to partner with the ambassador because they will know that we will provide the high level of care that has been initiated at the hospital, and this will be maintained for the patient's ultimate goal of returning home.
The difference in the Ambassador Health System versus other companies is the commitment to being nimble and changing with the industry expectations. We will ask directly to the hospital discharge planners, to the physicians that we work closely with, to know what their needs are. And if we know what their needs are and what's coming in terms of trends in the healthcare industry, we can more better serve our patients and our partners in the community.
You're needing a partner that can help you redefine how to help bend the cost curve that exists in healthcare today. I think we've got instance after instance after instance of how we've accommodated both partnering with the state, with our pediatric, with our pulmonary. We've done it for a great value, and we stand ready to be a great partner to an ACO that wants to take a hard look at us in terms of being an important part of providing that post-acute care, moving them through the continuum at a reasonable, cost-effective price, getting back home health care, and get them back into their natural setting. And we think we'd be a great partner.
Change is coming, so as you examine how to best serve your patients through an effective accountable care partnership, we trust that you won't find another organization as committed to representing the same quality care your patients expect from you as the ambassador.